Hello, welcome to a presentation on podiatric management and assessment. Today, we'll be discussing Frank's case study. Frank is a sales consultant. He's 52 years old. He plays golf and is overweight. He has been experiencing pain around the plantar medial tubercle of the calcaneus. We suspect that it might be calcaneal stress fracture or plantar fasciitis. With a lot of evidence and research, and also with Frank's presenting case, we have decided that he may be suffering from plantar fasciitis more than a calcaneal stress fracture. In the article by Weber, Wilt, Gall, Montegromi said that stress fractures of the calcaneus are not as common as those occurring in the metatarsals, tibia, and fibula. Due to their relatively uncommon incidence when compared to other stress fractures and other causes of heel pain, such as plantar fasciitis, they are often misdiagnosed or overlooked. Calcaneal stress fractures are common among certain populations, such as active people, athletes, and military personnel. Plantar fasciitis is more common than a calcaneal stress fracture. In fact, it is the most common heel pain. People of all ages are affected, but it is more common in individuals that are regular runners, overweight, and those whose work involves prolonged standing. Plantar fasciitis is a very painful foot condition caused by inflammation of insertion of the plantar fascia on the medial process of the calcaneal tuberosity. Some of the risk factors are being overweight, as there is an extra pressure on the plantar fascia. Work that involves prolonged standing or walking on hard surfaces can damage the plantar fascia. Certain sports, such as golf, can be a cause for plantar fasciitis as well. As the golf course is a terrain is conducive to pronate, as the grass is soft and thick. It's also sloppy and it's played on side hills. Golf players also walk a lot than normal. Also, their shoes are stiff and uncomfortable. During a golf swing, the feet pivot and pronate. Frank plays golf, is overweight, and his occupation as a sales consultant involves a lot of standing and walking. With all these reasons, we have decided that he has plantar fasciitis.
Our case study, Frank experiences pain around the plantar medial tubercle of the calcaneus. The differential diagnoses that we are investigating are plantar fasciitis and a calcaneal fracture. Plantar fasciitis and calcaneal fractures can be investigated and diagnosed using medical imaging technology. The most appropriate medical imaging technologies for plantar fasciitis are MRI and ultrasound. The most appropriate medical imaging technologies for calcaneal fracture are ultrasound, MRI, and X-ray. Before referring a patient for medical imaging, it is important first to consider a diagnostic algorithm. Please see our diagnostic algorithm, which includes the gathering of information and podiatric assessments, which should take place with the assessing podiatrist before referral to medical imaging.
X-ray was invented by Wilhelm Conrad Röntgen in 1895. He discovered a source of invisible rays which were capable of penetrating materials not normally translucent to ordinary light. He identified that the rays were able to pass through heavy paper covering, and slowly finding out that they were able to pass through human tissues. The first clinical radiograph image Röntgen produced from the X-rays was of his wife's hand. The function of an X-ray in the medical field is to be able to capture radiograph images of dense material in the human body, such as bone, while penetrating through skin and tissues. A patient will be placed between an X-ray source and a fluorescent screen. The reason for the fluorescent screen is to block the X-ray from going past the patient and obtaining dense material outside the body. X-rays are both beneficial and harmful to the human body. In terms of benefit, X-rays are very beneficial in detecting bone fractures, breaks, and spurs. Due to the bone being a dense material, it allows health practitioners to confirm the exact dimensions and severity in terms of a fracture and breaks, which could lead them to provide the best management outcomes for the patients. X-rays are used in fluoroscopy, which is able to see real-time imaging of the internal body structures. This assists health practitioners with patients who may have dilemmas with their digestive systems. In terms of cost, certain X-ray imaging could be inexpensive, which most are, but it depends on the imaging and specifics for the individual. In terms of harm, the main harm of X-ray is that it emits radiation to the human body. Therefore, it could be very harmful to the patient genetically and somatically. In terms of genetically, it may not affect the present generation, but it could affect the future generation in terms of mutation. For somatically, it could alter and damage cells of patients, which could lead to some areas of concern, such as increased incidence of cancer, effect on embryo and fetus during pregnancy, increased incidence of cataract, and decrease in lifespan. The exposure of radiation plays a crucial part in terms of harm. Therefore, health practitioners need to assess the patient and decide whether an X-ray is necessary for the benefit of the patient. In terms of Frank, due to the suspecting diagnosis of a calcaneal fracture, an X-ray imaging will be able to clarify that doubt to diagnose him. However, since he is also suspected that it may be a plantar fasciitis, an X-ray will be minimal or none in aiding to confirm the diagnosis, due to plantar fasciitis being less dense material in the human body. As a benefit to the patient's health, health practitioners should make sure that they utilize the option of an X-ray imaging as their last resort in terms of evidence to diagnose the patient.
Radionuclide bone scan has proven to be a sensitive imaging modality since the 1970s. Changes within the area of concern can be seen within 48 to 72 hours of injury via a bone scan. If the dynamic and blood pool images demonstrate normal or increased activity in the heel region, and the late static phase shows increased focal activity on the inferior calcaneal region, the etiological factor is most likely to be of an osseous origin, such as stress reaction or stress fracture. On the other hand, if the dynamic and blood pool images demonstrate diffused activity along the plantar fascia and a late static image reveals an increased focal activity on the inferior calcaneal region, the etiological factor is likely to be of a fascial origin such as plantar fasciitis. While bone scan has been shown to have a sensitivity of around 77.6%, it is usually not the first line of preferred medical imaging modality due to its reduced specificity. While the uptake of technetium-99m in case of osseous and fascial conditions can be used as a reference point, there is still an array of things that could be the causative factor of the presenting complaint of the patient, such as bone tumor, calcaneal spur, calcification, etc. Another shortcoming of bone scan is its cost burden and radiation exposure. A single bone scan has a radiation dose of 6 millisieverts. As a clinician, we must aim to achieve the least radiation exposure to achieve the best results for both the patient and us. Since there are other diagnostic imaging modalities that can be used as an alternative, bone scan can be excluded from the ideal imaging modality for Frank.
Ultrasound sends out high-frequency sound waves directed at the tissue being examined and record the reflected sound to create an image. Ultrasound provides high-resolution soft tissue and bone imaging. As a result, it is a very useful form of radiological imaging when there is a differential diagnosis between osseous and soft tissue injury. If there is an increased thickness and hypoechoic plantar fascia on the ultrasound imaging, it means plantar fasciitis is present on the feet. As you can see from the left image, the green arrowheads pointing the normal thickness of plantar fascia, and there is a regular echogenic appearance. Therefore, the left image is a normal plantar fascia. Conversely, on the right image, the plantar fascia is grossly thickened and appears hypoechoic on sonogram. Therefore, the right image is a plantar fasciitis. Ultrasound is safe and accessible. For example, ultrasound is cheap, non-invasive, safe, and no radiation exposure. Ultrasound also has a sensitivity of 91.9% and specificity of 90.5% in diagnosing plantar fasciitis. Therefore, diagnosis of plantar fasciitis using ultrasound imaging is ideal for Frank.
Magnetic resonance imaging is an imaging modality which can be used to display soft tissue and bone structures of the sole of the foot. Through past studies, it has been found that MRIs have an 80.9% sensitivity and 85.7% specificity to identifying disease process and morphological changes affecting the plantar fascia. Some of its advantages are the fact that it is non-invasive, that it does not produce any radiation to the patient, as well as it being the most sensitive imaging modality for diagnosing plantar fasciitis. This is because it can show the exact location and anatomical detail, extent of inflammation and edema on the T2 weighted images, and intrafascial T1 signal changes that occur within adjacent soft tissue or bone marrow. However, it also has some downsides, making it a second-line imaging modality and not ideal for Frank's case. This is because it is costly, has chances of producing negative results if the foot is inaccurately positioned in the extremity coil, and expertise is required. These factors then risk wasting time, and overall it's a pretty exhausting modality, which can be avoided using a simpler and more favourable imaging technique such as an ultrasound.
Decided that an ultrasound imaging is appropriate for Frank to undertake, as they are known to be the best imaging for tears in plantar fasciitis. It should also be considered as the first choice for assessing conditions related to plantar fascia, as it provides high resolution with quick and dynamic imaging of the plantar fascia. It has showed 80% sensitivity and 88.5% specificity. It is easy, quick, and very easily available.
This is our reference list. Thank you for listening to our presentation.